Hi, you guys. Welcome back for our daily practice questions. It is day 145 and day 15 of our Pharm series. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And don't forget to hit the subscribe button so you do not miss any of my videos. And if you would like access to my MP Test Success Toolkit, it's free and linked in the description. Question number one states, which of the following is considered first-line pharmacologic therapy for a patient with elevated LDL cholesterol levels? Is it A, fibrate, B, niacin, C, statins, or D, your bile acid sequestrants? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem is the question is the stem, and it states which of the following is considered first line pharmacologic therapy for a patient with elevated LDL cholesterol levels. And your best answer is C, statins. Remember that your statins are the ones that focus on reducing those LDLs. Okay, so and that's your bad cholesterol. So make sure you know which medications affect which labs. Question number two. A 45-year-old woman with no history of ASCVD presents with fasting triglycerides of 600 milligrams per deciliter. What is the best initial pharmacologic treatment to lower her triglyceride level and reduce the risk of pancreatitis? Is it A, statin, B, niacin, C, fibrate, or D, Zetia? Take a moment and tell me what you got, y'all. All right. So, stem of the question here states, what is the best initial pharmacologic treatment to lower her triglyceride level and reduce the risk of pancreatitis? So, this stem tells you everything, right? We're looking for the initial pharmacologic treatment. So, first line therapy to reduce your triglycerides. So, if you look back at the triglycerides, they're sitting at 600 milligrams per deciliter. Remember, if the triglycerides are greater than 500, when you're looking at your lipid panel, we're going to treat the triglycerides first. And you want to consider pancreatitis being the cause of it being this significantly elevated, right? And so you can treat with fibrates and niacin, but latest guidelines tell you the first line treatment to reduce their triglycerides that are this elevated are your fibrates, C, fibrates. And also, niacins are not as effective or commonly utilized in a form or from a perspective of compliance because it can cause that really heavy flushing. So a lot of people complain of that strong flushed hot feeling that they get when taking that. So often people aren't as compliant. So yes, niacins are utilized for lowering those triglycerides. I know this is a question I get a lot, but latest guidelines, your fibrates are first line for reducing those triglycerides 500 and greater. Okay. And question number three, a 30-year-old male with total cholesterol of 250 milligrams per deciliter, a LDL of 140 milligrams per deciliter, and no other cardiovascular risk factors wants to begin management. What is the most appropriate first step in treatment? Is it A, begin statin therapy immediately? Is it B, lifestyle modification and reassess in 3 months? Is it C, start your Zetia? Or is it D, prescribe a fibrate? Take a moment and tell me what you got. All right, instead of the question here, what is the most appropriate first step in treatment? All right, so what are we treating? So we have a 30-year-old male. Total cholesterol is 250 milligrams per deciliter and LDL 140 milligrams per deciliter. He has no other comorbidities or cardiovascular risk factors, and he wants to begin management. All right, so in a perfect world, on exams, you know that this total cholesterol is greater than 200 and the LDL is greater than 100. But this is a young, healthy male, no other cardiovascular risk factors. You want to start your lifestyle modification and reassess in 3 months. Now, the reason that I said focusing in on those lab values, typically for testing purposes, when they're giving you these lab values, there's some other scenarios going on and they want you to go directly into treatment. But this patient has not even started lifestyle modifications or anything. So, we start our lifestyle mods. He doesn't have any other risk factors. If he did have risk factors, we would go directly into your statin therapy. Remember, Brittany's Brilliance, I tell you to start with a statin, right? So if he had cardiovascular risk factors or an elevated ASCVD score, or multiple comorbidities, you would go ahead and start the statin therapy because you would want to go ahead and get on top of this and reduce the risk for increased heart disease, right? But this is a healthier person, so we want to go ahead and get these lifestyle modifications, reassess in 3 months, and see if that resolves the issue. Now, when you bring him back in 3 months, if he's still sitting here or worse, start your statin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.